Good afternoon, dear viewers. Glad to welcome you on our channel, where we always try to provide you with useful and important information about health. Today's video is dedicated to an important and serious topic, colon cancer. Let's dive into this topic and find out why it is so important for our health. The importance of knowing about colorectal cancer is that its symptoms are not always noticeable in the early stages, and patients may not pay much attention to them. But early detection of this disease can save lives. That's why we decided to make this video to help you learn about some of the signs and symptoms of colorectal cancer that you should look out for. Colorectal cancer is a malignant tumor that can form in different parts of the colon or colon. It belongs to a group of cancers of the digestive system and can arise from polyps, small growths on the inner wall of the intestine. Over time, some of the polyps may become cancerous tumors. A feature of colorectal cancer is that it can develop for long periods of time without any noticeable symptoms. This makes it difficult to detect early, which in turn increases the risk to the patient. However, in the early stages of the disease, colorectal cancer usually has a good prognosis for recovery, so it is important to be aware of risk factors and risk groups. One of the main risk factors is age. The risk of developing colorectal cancer increases with age, and most cases are diagnosed in people over the age of 50. However, recent studies have shown that the disease can also occur in younger people, so it is important to be vigilant at any age. A family history of colorectal cancer is also a risk factor. If close relatives, such as parents, brothers, sisters, or children have been diagnosed with colorectal cancer, the likelihood of developing it increases. Lifestyle and diet will also play a role. Lack of physical activity, eating a lot of red meat, and heavy consumption of fats and preservatives can increase the risk of developing colorectal cancer. It's also worth looking at the presence of chronic bowel diseases such as ulcerative colitis and Crohn's disease, which can increase the risk of developing colorectal cancer. As we continue to talk about colorectal cancer, today we're going to look at the first sign that can indicate possible problems: changes in bowel habits. Let's break down what they mean and why it's so important to pay attention to such changes. Bowel habits are how often and how each of us empties our bowels. Normal bowel habits can vary from person to person, and it's important to know that changes in this area can be signs of disease, including colon cancer. One common symptom is constant constipation. If you find that you are having trouble emptying regularly and have diarrhea that continues for days or even weeks, this can be a red flag. It is important to pay attention to changes in stool consistency and frequency of emptying. On the other hand, diarrhea or frequent stools can also be a sign of intestinal problems. If you experience unexplained changes in your stools, such as stools becoming more liquid or having an unusual color, this also needs attention. It is important to note that changes in bowel habits can be caused by a variety of factors and do not always mean colorectal cancer. However, they are one of the first signs that doctors look out for when examining for disease. If you notice such changes in your bowel habits, it is highly recommended that you see a doctor for a professional consultation and examination. You should not ignore such symptoms, as early detection of colorectal cancer significantly increases the chances of successful treatment and recovery. Blood in the feces is a symptom that always requires serious attention. It can be visible to the naked eye in the stool or manifest itself as a dark, sludge-like discharge. Either way, it is a clear signal that something is wrong in the body. Blood in the stool can be associated with various problems, and one of the possible causes is colon cancer. The presence of a tumor can cause blood vessels to rupture, which causes bleeding. When this occurs, the blood mixes with the stool and becomes visible. However, blood in the stool can also be due to other causes that are not necessarily related to cancer. For example, hemorrhoids or anal fissures can be the cause of bleeding when emptying the bowel. Inflammatory bowel diseases such as ulcerative colitis or Crohn's disease can also cause bloody discharge. It is important to realize that regardless of the cause, blood in feces is an alarming signal that there are changes in the body that require attention and examination. If you find blood in the feces, do not delay a visit to the doctor. Passing an examination will help to find out the cause of this symptom and establish the correct diagnosis. Doctors may order a colonoscopy or other tests that will allow them to see the condition of the colon from the inside and identify possible problems. Colon cancer can also affect a person's appetite. If you notice that you begin to feel less interested in eating or lose your appetite, this may be a result of the disease. A tumor in the intestine can cause a feeling of pressure or fullness, which reduces the desire to eat. In addition, a tumor can cause changes in bowel function and increase the feeling of fullness even with a small meal. Another alarming symptom is involuntary weight loss. If you notice that you have started losing weight for no apparent reason, it could be a sign of a medical condition. Colorectal cancer can disrupt digestion and nutrient absorption, leading to weight loss even with a normal diet. Particularly alarming is that involuntary weight loss usually occurs in the early stages of the disease, when other symptoms may not yet be evident. Therefore, if you notice a worsening appetite and involuntary weight loss, it may be a signal that your body is undergoing changes that require immediate attention. Regardless of what caused these symptoms, it is important to see a specialist for an examination and to find out the cause. Only an experienced doctor will be able to determine the source of the problem and prescribe the right treatment. Let's continue to consider the signs that can indicate colon cancer. And now let's pay attention to the fourth sign: constant fatigue and weakness. Let's understand how these symptoms are related to the disease and why it is important to seek medical attention if they are present. Colorectal cancer can cause chronic fatigue in patients. This is because the tumor can cause a disruption in digestion and nutrient absorption, leading to a lack of energy in the body. In addition, the very process of the body fighting the tumor requires a large amount of energy, which can also lead to poor general health and constant fatigue. Another cause of fatigue in colon cancer patients is anemia. The tumor can cause bleeding, which leads to a decrease in red blood cell levels and the development of anemia. Anemia impairs oxygen supply to tissues, including muscles and organs, leading to weakness and fatigue. If you are experiencing prolonged fatigue and weakness, it could be a sign that something is not right in your body. Do not ignore these symptoms, as they can be linked to diseases including colon cancer. See your doctor for a thorough examination to find out the cause of the fatigue. Doctors will perform necessary tests, including blood tests, to determine hemoglobin levels and detect the presence of anemia. A colonoscopy may also be ordered to take a closer look at the colon and identify possible problems. Bowel obstruction is a condition in which feces, gases, and liquids cannot pass through the intestines due to an obstruction of some kind. In colorectal cancer, the obstruction may be caused by a tumor that has blocked the intestinal lumen. This condition can be dangerous and requires immediate intervention. One of the main symptoms of bowel obstruction is severe cramping and abdominal pain. These can occur because feces and gases cannot pass through the blocked intestine and accumulate, causing pressure on the walls of the organ. In addition, obstruction may result in a lack of gas and stools, which is also an alarming sign. If bowel obstruction is suspected, medical attention should be sought immediately. This condition can lead to the development of severe complications, including bowel rupture and abdominal infection. Doctors will perform the necessary tests, including X-rays or CT scans, to determine the cause of the obstruction and prescribe appropriate treatment. In some cases, surgery may be required to remove the obstruction and restore normal bowel passage. The earlier medical attention is given, the better the chances of successful treatment and avoiding serious complications. Here we are at the end of our important conversation about colorectal cancer. Let's summarize and once again recall the 5 signs and symptoms that may be associated with this disease. The first sign is changes in bowel habits. Worry if you notice constant constipation, diarrhea, or frequent stools. The second sign is blood in the feces. This symptom should not be ignored, as it can be a warning sign. The third sign is deterioration of appetite and obscene weight loss. Pay attention to changes in your appetite and weight, especially if they are not related to diet or physical activity. The fourth sign is constant fatigue and weakness. If you feel constantly fatigued for no apparent reason, this may be a sign of illness. Finally, the fifth sign is bowel obstruction. Pay attention to severe abdominal pain, no gas or stools. Remember that none of these signs by themselves is a definite diagnosis of colon cancer, but their presence can be a warning sign that something is not right in your body. You shouldn't panic, but you also shouldn't ignore suspicious symptoms. If you notice such signs in yourself or a loved one, be sure to see a doctor for a thorough examination and to identify the cause. Early detection of colorectal cancer can save lives, so never delay a visit to a specialist, even if the symptoms seem mild or subtle. Taking care of your health and getting regular medical checkups is key to preventing many diseases and successfully treating them. Remember, your health is the most valuable thing you have, and it deserves care and attention. Thank you for spending this time with me. If you found this interesting and helpful, please subscribe to our channel and give us a like. This will help us continue to share important health information and stay close to you. Take care of yourself and your loved ones. Be mindful of your body, and see you soon.